So we have our last session. This is going to be exciting. It's our new startup panel. And so the new startup panel members, please come up. I told you at the beginning of today you're going to hear some crazy ideas. One of them's coming up right now. His name is Josh. But, one thing we do, and like I said at the very beginning of today, we want to empower entrepreneurs. We want students, faculty, staff, really anybody with an idea. And so these are three individuals who have really interesting ideas, and we asked them to come today just to share what their idea is, what they're working on, any traction they've gotten, and ask them very specific questions about their entrepreneurial journey. So I'll be thinking of questions as I ask, but I want you to, if you don't mind, to first introduce yourselves and tell us a little bit about your idea.
My name is Josh Otero, and I'm a co-founder and CEO of NutriGMR. We are a nutrition and performance company that's focused on eSport athletes. Esports athletes are the fastest growing sport in the world, and I'll get a little bit more into the demographics and everything like that, but yeah, esports and nutrition are becoming a bigger and bigger thing, and we see that, and we want to take advantage and help these athletes become like professional, regular sport athletes.
Hi everyone, super excited to be here. I'm Dr. Ryan Stoll. I'm a PhD in clinical psychology, but really a social entrepreneur at heart. I'm the founder and co-creator of Compass for Courage. We provide right now K-8 schools with brief, easy-to-use, and game-based interventions to prevent anxiety disorders from starting in childhood and early adolescence. So our focus is on, taking strong science that's been developed over the last 30 years and packaging it in a way that everyday people can use and benefit from what we're doing from more of a preventative stance. Is we don't have to wait until anxiety and mental health in kids is a problem to affect change and to begin addressing those issues that come along with, out of control anxiety and out of control mental health over the lifespan.
Hi, my name is Jasmine Body. I am a nurse, and I am a PhD student here in the College of Nursing and Health Innovation. The focus of my research is for looking at alternative ways of addressing nutrition for head and neck cancer patients in particular. But along my journey, I've realized that we can do better for our patients and their outcomes, and that nurses have a tremendous role to play in this. I just really think that we're not utilizing nurses to the fullest capacity possible, and what we're really missing is a direct consumer application to connect patients to nurses who can provide anything from companionship to education, assessments in the home, making sure that they're not socially isolated, helping with their care coordination. So that's kind of really where I'm at.
Okay. So can you keep the mic? We'll just go this way and then that way. And I'm noticing in this conference, I'm learning a lot about microphones, and some people are just louder than others, so you need to speak up a little bit, just make sure everybody in the back can hear, and speak right into it. But can you share a little bit about, first of all, why? Why did you start what you're doing? And then maybe, how? And we'll just take a minute or two and just come back this way. So why, and then how?
Why and how. Okay, so as a nurse, I oftentimes get requests from patients, can you help take care of me after when I'm discharged? Because there's a gap. We have patients when they're discharged from the hospital, they either qualify for home health or assistance or they don't. And oftentimes we don't give them enough of home health so that they can properly take care of themselves. So really helping to give them the knowledge so they can have the confidence and self-efficacy to actually take care of themselves. So after having numerous requests from patients to help assist them after their hospitalization, and then also companionship. So according to AARP, 33% of baby boomers feel afraid to fly. So they're limiting their life because they're afraid to travel alone. But imagine if you could hire a nurse who will sit next to you and fly with you where you'd like. And it's a fraction of the cost of if, I discharge a patient from where I work and they need to go back to Houston. Sometimes these flights are like $8,000 to $10,000. You don't necessarily always have that money in the bank sitting and waiting to travel back home after an unexpected hospitalization, but just in general, for traveling, let people have the best quality of life. So how, actually, I had this idea, and coming to this conference last year was the first time that I was like, I need to do something with this. And Dr. Hall was actually very instrumental in that, connected me to students in the College of Engineering, and we built a platform. So we're really working on an algorithm that pairs the most qualified nurse with the needs and condition of the person who's looking for the services. So we built software application, and now actually kind of working on developing the education of the community, because people don't understand that you can utilize a nurse and you don't have to have them always in a hospital setting. So that's really where we're at right now.
Very good.
So how and why? That's a great questions, Rick. So Compass actually emerged out of a few different reasons, or emerged from a few different reasons, all stemming from my time as a PhD student. I joined a research lab long time ago as an undergrad at ASU that was focused on understanding anxiety in children, both in terms of how it develops, why it exists, and really where I have developed my interest is how do we effectively prevent anxiety from occurring altogether? So in the early stages, we were developing and working on research here at ASU to develop a school-based preventative intervention. So we, took all the science we had, collaborated with schools all around the valley to really understand how we could best package what works into something that's sustainable and can affect change eventually at a much larger scale than we're currently achieving with our mental health care efforts. And, halfway through my PhD work, I realized and learned that there's hundreds of interventions that are non-medication based that can both effectively treat and prevent all of the major mental health disorders and problems facing our youth, families, and communities today. Anxiety, depression, substance abuse, early sexual behavior, HIV, all of these problems, we have developed, at least in some capacity in our scientific fields, ways to mitigate those risks very early on so we can avert all the long-term negative consequences that go along with them. But the problem is, as scientists, we develop these programs and we develop these high quality and well-tested interventions, but then there's no infrastructure to actually bring them to the people in ways that make sense for them, in ways that they can actually engage and use and sustainably benefit from beyond just what we do as scientists. So, early in, that was kind of the motivation, was there's this massive gap between what works and what people have access to. And personally, to me, it was kind of unacceptable, both as a scientist and as an entrepreneur, that we hadn't solved that gap yet, and we hadn't addressed that. So it was kind of, we have this program, we've tested it, and then I happen to have a background before grad school and before psychology in design and marketing and business. So I decided, why not combine these worlds? Why not take what we know as scientists and combine that with strong design, customer experience, and use these entrepreneurial models that we've already developed to affect change at much larger levels. And that's kind of how Compass has emerged over the last few years. And luckily, ASU has a super great resource for entrepreneurship. So I was able to take Compass from the lab into almost 50 schools now today by ASU's seed funding opportunities and pitch and demo day and getting funds in that avenue to push this work out at a quicker pace than where we're at, because our youth and families and communities deserve better care, and that care exists already. It's just locked away in journals, in libraries, and sitting on shelves just collecting dust, waiting for somebody or people to bring it to our communities so they can actually benefit from what we've been doing all these years.
Great.
So how many of you have kids? How many of you have kids that game?
Play video games.
Play video games. How many of you have heard of eSports? Great. So eSports is the fastest growing sport in the world. So we have this demographic. Anyone under age 25 typically is playing video games anywhere in the world. If you're in the US or China, it's almost 100%. Our co-founder was studying esport players and gamers for the last couple of years. He noticed there's a huge deficiency in what these kids and adults are eating and drinking. We saw an opportunity to create something healthy for them that actually worked and was performance driven. So we studied esport athletes for the last 2 years and created something that will help them focus and perform better. There's over 454 million children and young adults that game across the entire world, and there's over 1.6 billion that do it on a part-time basis, meaning 2 or 3 times a week they play video games. So we saw this huge need, and guess what most of them are doing? Sitting. For how many hours at a time? 6, 8, 10, 12, if they're professional, 14 hours a day. So that's a problem if that's all they're doing. So our goal is to educate them on nutrition, also educate them on movement and why exercise and different health aspects will help improve their performance. Because guess what? This year, a 16-year-old kid won $3 million in a tournament. Let me say that again. A 16-year-old won $3 million in a tournament, eSports tournament. 2 weeks after that, 3 kids, all under 20, won $3 million each in an eSports tournament. So this is no longer your little, your kids playing in the basement, gaming for a couple hours. This is kids and young adults, and some adults playing this as a profession all day long, and now they need to actually train and think like athletes. So we're teaching them to be and train like real athletes because they are. These are cognitive athletes. They may not be throwing around big weights or throwing the football around, but they are throwing their minds around, and that's just as important and just as demanding as physical. So we designed NutriGMR to help these athletes perform at a higher level and provide them the nutrition and the education that they need to perform at the next level.
So I said it's a little crazy, but I don't know if you're all aware, but the ASU has a team. We have an esports team. Grand Canyon University has a sports team. They're building arenas in different cities in Asia for people to go watch people play video games. So it's a paradigm shift for me. I mean, we've been telling our kids for years, you're never going to make anything of yourself if you're playing video games, and we're wrong about that. So I'm curious if you guys could now just explain a little bit about your struggles starting your business, and in the same question, where you're at now. I guess we'll start there. Where you're at now, maybe some of the traction you've had so far, and then what do you need next? Like what do you need next to make your startup successful?
So I think it starts with money, right? Every business takes money. So that's I think the largest struggle and the biggest struggle for us is, we are pre-revenue currently. We're raising a round. We should be hopefully completing the round by the end of the year, next few weeks. But I'd say our biggest challenge to date has been money. Now, we've been lucky enough to work with ASU and other education facilities provide us some resources, so we didn't need as much money. But we've had a lot of success in talking to investors. As you guys are starting to realize, esports is a real thing, and it's only getting started. So there's a lot of investors now starting to look at esports, and especially athletes. Professional athletes are looking to diversify into esports, so that's helped us a lot. So currently our traction, we're working on a program with ASU esports program and GCU sports program to work with it's our drink mix that helps. It's basically an alternative to Mountain Dews and Gatorades and all the other sugary, unhealthy drinks to provide them true cognitive support and the nutrition they need in that demanding sport. So we're going to be starting our program with GCU esports program and ASU esports program here relatively shortly. We've had samples made. They're getting delivered here in the next 2 weeks. And then, like I said, we're going to get funding. Hopefully, I got a call today, so hopefully by the end of the year we'll have funding, and then we're launching in the first quarter of next year.
Great.
Yeah, so I founded Compass for Courage in 2017. I was halfway through my PhD program at the time. And at that point, we probably 9 to 12 schools were using Compass for Courage. And when I say that, what I mean is we train mental health providers that are in schools, like counselors, social workers, psychologists, to use our tools that are designed to be effective, evidence-based, and they're all game-based. So we teach mental health skills through board games, role play activities, and collaborative game-based approaches. So we aren't doing the traditional way of therapy where it's just talking one-on-one or talking in a small group. It's more interactive and dynamic. Since 2017, we're now in revenue as of this year, a little bit, and we're in about 50 schools. So when we think about 50 schools, that means every one of our providers that we train in these schools is helping about 12 kids every year at minimum that are struggling with anxiety, that are already experiencing these higher levels of anxiety that we want to avert, because what we know from a long line of history and science is if we don't intervene early and effectively, that high anxiety will transition and turn into a disorder pretty aggressively without support. So right now we're in this phase of, getting the product out. It's ready to go. We're selling. We're in the schools training people, and really finding both strategic partners to help us scale our distribution and try to get into really as many schools as we can first in Arizona to validate this model and to validate this approach before scaling outside of Arizona. So that requires, both partnerships and then also, money to be able to do that and funding. So for me, I've been able to leverage ASU as a student up until I graduated, using their seed funds and their mentorship and all of these things to get me to where we're at now with Compass, but now it's starting to move beyond that ecosystem and find those strategic partners and start raising funds to realistically do this at a much bigger scale and have a much greater impact on our outcomes and our kids and our communities and families.
Okay, so I think I told you first I'm a nurse, right? So for me, the biggest struggle has actually been asking for help, and really it's asking for money. So far it's just kind of been bootstrapping, raising funds as I go along, applying for grants. Being a PhD student, I'm familiar at kind of writing now, so I think I can write and ask for what I'm looking for, so that's helpful. But business is entirely new for me, so trying to balance school and still working in the hospital and trying to learn about business has been very insightful and rewarding, but it definitely kind of takes away from my own self-care and taking care of myself. So I don't know, I think that's probably been a challenge for me, honestly, is really trying to figure out how to balance everything. We're fortunate enough that I'll be doing a workshop with a very successful venture builder this next month. And so hopefully when we're done with this, we'll be able to have an angel investor hopefully fund a good portion of what we're hoping to do, and that will be a dream come true. So if not, we'll just kind of pivot as we go along. So I think it's just learning how to constantly remain flexible and not doubting myself. Like, I know I can do this, and I know it's meaningful, and kind of waking up, and when you do have rejection, sometimes what you do, it's kind of, all right, I'm going to get up and get back at it again. So
very good. I have one final question, then we'll take some. Did we go this way already? You've already answered it, right?
No, so I think we're talking about challenges right now.
Sure.
I thought
we did it. Okay, go ahead.
So as a psychologist, when you're going through that world of clinical psychology, the ultimate goal, right, is you're both becoming a researcher and a therapist. And I did that path for quite a while, halfway through, 3 years of that work, working here as a counselor at ASU Counseling Services. And, halfway at that point was when I decided to make the pivot to Compass. And what that meant for me professionally and where the challenge was, is I'm a psychologist. I had no formal training in anything related to entrepreneurship. I had to create my own curriculum. I ended up opting out of, additional clinical training to be a therapist so I could pour myself into and use all of the resources and people I could to learn how to take this idea and combine it with the knowledge that I've had in grad school and actually put it out into the world as a business that can have both an impact on people but also be self-sustaining through the revenue we're able to generate through sales, as opposed to what we traditionally do in my field, which is, develop it, put it out, and hope for the best. So really the challenge was balancing being a clinical, psychology student, doing grad school, doing all of that work that goes into it, and then simultaneously trying to figure out how to start a business and learn the ins and outs of what a business model canvas is, how do you raise funding, who do you need to talk to, and really learning from other people well further on in their journey than I was, because they were already there. So let me just build off of, the stand on the shoulders of giants, as people say, right, is, you just have to learn, but that's so much of the challenge, is getting to that point of, I don't know what I'm doing, but I'm just going to go ahead and do it anyways and hope for the best and see what happens and kind of go from there.
Yeah, I think so too. So why don't we take questions? So, Dean?
So my question is twofold, and it relates partly to the panelists, but also to one of the speakers from this morning, who I think is here, Claudia Whitehead, if you're still here. The question relates to, with an innovative idea, in a traditional business plan, you would have to do market research and show the supply and demand, and there was a rote process. It was tedious. And we have a very different marketplace now where we might not be able to get that kind of traditional data. For example, the NutriGMR, I didn't even know what that was. How do you show a traditional financer that there is a definite demand and a supply and a market for that, and you can make the money? And how do we in Phoenix turn this environment here into an environment where a young person with an idea, and I'm asking this question partly from the viewpoint of being a faculty member who teaches first and second year classes in innovation, have a degree in business. Many of them have good ideas, but when I ask them about their sense of confidence or their vision or what is their creative environment, they don't really know how to answer that. They don't see themselves as actually being able to do this. They have ideas, it's a dream, but they don't know how to get from A to Z, even though they have a really good idea. So I'm wondering, do we really need good traditional market research? What can Phoenix do to provide an environment where we can really give the foundation of a good business sense for today's market for young people who haven't had the life experience that someone like me has had, who did a degree in business, I did internships, all the soft skills, I learned all that and practiced. It's very different now. If anyone could weigh in, I would really appreciate it.
Absolutely. So the question, for NutriGamer, on how do we show traction when it's such a new sport or new, something new, when there's not a lot of research out there. So, and I've spoken to VCs all over the country, angels and everything like that, and it's traction. And eSports, we could show it. It's the growth in eSports is unbelievable. So in any business, if you could show traction, right, that's the number one thing that the first thing that they ask is, what's the traction? What's it like? What's the growth like? So we don't need all the stats and everything like that. All we do to show them is the traction, right? We could show the numbers. We could show eSports was nothing 5 years ago to now it's the fastest growing sport in the world, where there's over 150 universities and colleges that have eSport programs that are recognized as varsity sports, meaning they give scholarships. So, and that was, almost 3 years ago. So it's showing traction and the ability to have growth potential for the businesses.
Yeah, I think that was a really great question, particularly around the market research side of innovation and social impact businesses, because it is kind of a hard sell a bit depending on who you're pitching it to. So for Compass, I took kind of an integrative approach of looking at the research literature to understand how many children are struggling with anxiety. What does the life course look like? What do the financial outcomes look like from a scientific side? Because we have those data. We've been doing this work in anxiety specifically for 30 to 50 years. There's a ton of research out there. But then it's combining that with traditional market research approaches to really understand, yes, anxiety and mental health is a problem that we need to effectively address and prevent, but that doesn't necessarily mean you can build a business around that. So you have to understand both scientifically from a social impact perspective in terms of what is needed, but also market in terms of where the demand actually is. And to me, with anxiety, it's an easy story, at least maybe easy, maybe that's not the best word, but is, 1 out of every 5 children and teens will likely develop an anxiety disorder at some point in their life. 80% of those that are struggling with anxiety will never receive care that is effective and will support them long term. And the anxiety in childhood that goes unaddressed in the long term is linked directly to clinical depression, suicide, and substance abuse in adulthood. And what we know is if we can avert anxiety, we are saving money, we are saving time, we are saving heartache, we are saving suffering early enough that there's a market there, because we can avert costs for taxpayers, for third-party insurance providers. Anybody that's involved in the ecosystem of healthcare is directly affected by how early and how effective we are at addressing mental health early in our kids, so they don't grow up to become the anxious adults of the future.
And I'll just say, again, thank you for the question. I definitely echo what you're saying about going back to the literature and looking at what does the research show, because that's really where we need to start with our information. For me, what I'm proposing is really looking at core care coordination, mixing that with statistics of what's exactly, what does our population look like now, what is it going to look like in 20 years, how do we meet those demands. But I think it's also important that we're very thoughtful about collecting the right data to then support how we're growing and what we're doing. So just as much as it is to build it, I think to sustain and really look forward, as scientists, we really need to be collecting the right data.
Yeah, and I kind of want to build off of that point for a second is, that's part of this process is we have to assume when we're in the public health space and we're scientists coming to market with an innovation is we are coming with the knowledge of what works on a scientific perspective, not necessarily what works where that science is meant to live. So we have to engage with providers, with consumers, with all of these stakeholders that are involved in providing and supporting the health and well-being of our society to understand how we can best take what we learn in the lab and put it in the community in ways that we know it can have an impact and we can have it be sustainable. But we have to be talking to each other and learning and not assuming that just because we know the science, we know everything else that can go into that.